I'd like you to listen to some of my patients as they relate their experience with glaucoma in terms of control and diagnosis.
In my early 40s, when I got the long arm disease and I couldn't read the newspaper at a comfortable length anymore, went for a routine eye exam. And at that point, the pressure in the right eye was slightly elevated. In the left eye, the pressure was fine. But because there was a suspect of glaucoma, then I started using drops in both eyes. This continued for several years, but what would happen is in the right eye, after a certain length of time, the pressure would increase. So we would try a new medication. After another length of time, the pressure would increase again, try a different medication, and this just continued for several years. Then finally, one time, it was, I think, over a Labor Day weekend, it was just out of control almost. I felt it. Previous to that, I had not felt the pressure, but I could actually feel the pressure rising at that point. I think when I went to the doctor, it was probably real high 30s. And that was when I was then referred to a glaucoma specialist.
I had 2 implants, one in the left eye, one in the right. The one in the left one, I think that was did about 3 years ago. See, my left eye is not too good because I had what's called detached retina. Oh, that's way back in 1988. So that kind of, made my vision a little bad. But I could see out of it, not as good. So the doctor, that's recommended you to keep from losing his vision, completely losing. I had to have that, I had to put called a drain or whatever it is in there, left eye. And then, so that kept it up a whole lot. So, other words, it's under control.
And then how about your right eye?
My right eye, that's when the doctor used to did everything they could because they, other words, to keep from going through the surgery, put an implant. And then he told me he done did all he could do. See, I'm gonna have to have this implant in my right eye. See, if I don't, I will, in the long run, he said I might lose my right eye.
When I was 9, I was diagnosed with iritis. It's an inflammation of the eye. And over, the course of my life, up until 25, I used Predforte, a steroid drop, just, on occasion when the iritis flared up. And I had no problems with that. When I was 25, my eyes started responding with the pressures going up. And at that point, I was diagnosed with glaucoma. I was having a lot of problems with my right eye at that time. It would flip from one eye to the next. So at one point, my doctor suggested surgery, and I went ahead and had it in the right eye. After the surgery, the right eye was fine. It was stable. I wasn't having any problems with the pressure elevating. And then my left eye started reacting to the steroid drops, exactly like my right eye. So at that point, I actually waited for the surgery, and I lost a little bit of vision in my left eye, and then I got the surgery, and it stabilized too.